We continue to follow the breaking news on former President Joe Biden's aggressive prostate cancer diagnosis. The office of the 82-year-old former commander-in-chief issued a statement today saying, in part, quote, he was diagnosed with prostate cancer characterized by a Gleason score of 9, grade group 5, with metastasis to the bone. While this represents a more aggressive form of the disease, the cancer appears to be hormone sensitive, which allows for effective management, and the president and his family are reviewing treatment options with his physicians. Let's bring in Fox News medical contributor and board-certified radiologist, Dr. Nicole Saphier. Doctor, you deal with cancer on a daily basis. What's your take on what the doctors have told us? Granted, you haven't been able to see the imaging or the test results, but based on what we've heard so far, give us your top line and what you see happening here with President Joe Biden.
Well, of course, my heart goes out to former President Biden and his entire family. Anyone who hears the word cancer, it is devastating, especially when you have a son who has passed from cancer. I'm sure this triggered a lot of emotion in President Biden. So what we know so far is not a lot of information, but what the family has told us is that he has been diagnosed with an aggressive form of prostate cancer. They said that it is metastasized to his bone. So let's kind of break down what prostate cancer is. It's very similar to breast cancer, which I deal with on a day-to-day. It's not one size fits all. It's not very black and white. There are many different types, and they act very differently, and you treat them very differently. So the information that we have about former President Biden's cancer is that it is a Gleason score of 9. Now, the Gleason is scored from 2 to 10, 10 being the most aggressive, meaning it grows the fastest. It has the highest risk of it metastasizing outside of the prostate gland. So 9 we would consider very aggressive, meaning it's very fast moving. You look at this by when you do a biopsy of the prostate, you base this score on what you see under the microscope, how quickly those cells are dividing, how many cells are actually there. So they've given him a Gleason score of 9, and the other information that they have told us is that it is already metastasized to the bone, which, as we know, this is stage 4. So when you talk about prostate cancer, it can be local, meaning it is confined to the prostate. The prostate is encapsulated, so that is the best case scenario when the cancer is actually confined to the prostate, still within the capsule. It can have local spread, meaning it has gone through the capsule. Sometimes it's just gone into the surrounding fascia, into the local regional lymph nodes, or in President Biden's case, it does sound as now it has gone to his bone. So again, stage 4. Now, when we talk about prostate cancer, the survivability for the most part, it can be at 100% at 5 years if it's caught early. When it goes to stage 4, especially if it's more aggressive, that 5-year survivability is significantly decreased with numbers less than 35%. Every case is different, as I said, not 2 cases are exactly the same. But the one good thing that they did mention about President Biden's case is that it is hormone sensitive. So there's a way to actually treat this, either surgically or through medications, where you actually give him anti-androgen therapy to kind of stop the testosterone, because his particular tumor needs testosterone and these androgens, these other hormones, to grow. So by stopping them, that's a way to manage disease. And I know when people hear stage 4, they get very nervous. Obviously, that is worst case scenario when you're talking about cancer. But we have so many treatments these days that you can actually live for quite a long time with stage 4 cancers. And it sounds, again, like in his case, because it is hormone sensitive, there are treatment methods. It's never going to cure him. He's never not going to have stage 4 cancer, but he could get to the point where he has no evidence of disease, or no progression of disease. And at this point, that's what our goal is.
Dr. Saphier, you work at one of the best cancer hospitals in the world. And even though this particular cancer is not your specialty, you see it all the time at the hospital where you are. So have you seen patients come in with this same diagnosis as President Biden do well with the kinds of therapies that you're talking about? Have you, in an older man like him?
So undoubtedly, 80% of my time I am strictly breast cancer, but of my time in the hospital, I am reading scans of all different types of cancers. So I see prostate cancer patients every single day, specifically those that have had metastatic disease. And yes, I've seen people living with metastatic prostate cancer 5 years, 10 years. Now, again, President Biden has a very aggressive cancer, Gleason 9. So that does make it that it's more aggressive, maybe won't necessarily respond as well, but it still might. He's also 82 years old, so that is a factor. But I will tell you that I read scans up until people of, I think 101 is the oldest that I have read a CT scan. But his age is definitely a factor, and how well he does on these medications, how well he tolerates any potential side effects that he may have, as well as some of his confounding already existing illnesses. We know that he has a history of cardiovascular disease. He's had a prior brain aneurysm in the past. He's had some cognitive issues, and we also see that he's had some gait issues, osteoarthritis issues. All of this kind of comes together. When you talk about metastatic prostate cancer to the bone pain can be one of the most horrific pains that anyone can experience, and sometimes that can be very difficult to manage. So my biggest hope is that if he is in some pain, that they are helping him, making sure that he's very comfortable while they're treating him to try and have less effect on his bones.
Hey, Nicole, it's Joe Concha. The last public health check for Joe Biden was in February of 2024. He got a clean bill of health. Is this cancer that aggressive that since that time, we're talking about 15 months ago, that this could have formed, metastasized, gone to the bone in that time? Is it that aggressive?
So it's a really good question, Joe. So the last we really have an annual exam of President Biden is over a year now. When it comes to prostate cancer screening, from about 55 to the age of 69, the numbers are kind of wax and wane. People kind of do different things. That's when you have that conversation about screening for prostate cancer, whether that's with a physical exam, trying to feel the prostate itself for any hardened nodules, or if you do the blood test to see if there are any markers that have been raised. I don't know if President Biden has been being screened for prostate cancer. I haven't seen any PSA results, and they haven't mentioned it in any of his physical exams. But again, at his age, actually, there's a recommendation against screening for prostate cancer at that age from a lot of societies. So I'm not sure that he's actually been screened for it. Now, most prostate cancers, the more common ones, are less aggressive. And sometimes that can take anywhere from 5 to 10 years from when that tumor develops for it to metastasize. Can be very slow growing. But again, President Biden's is Gleason score of 9, meaning very aggressive, very fast growing. So it is possible that it did develop in the last couple of years and it has metastasized. You have to remember, Joe, when cancer develops, it doesn't start out as something very big, something that you can feel. It doesn't cause symptoms. It's not until it really spreads do you really have those symptoms.
Dr. Saphier, just real quick, you had mentioned that you recommend against screening for his age group, but 1 in 8 men will be diagnosed with prostate cancer in their lifetimes, approximately. So what age group should get screened, and how does that screening take place? What are your recommendations there?
So a really good question, Lisa. And when it comes to cancer screening, there's a lot of controversy with it because sometimes they say that we're overdiagnosing and overtreating patients. And when it comes to these very common cancers like prostate cancer is the number 2 most common cancer in men, secondary to non-melanoma skin cancer. So it's obviously very common. A large amount of prostate cancer, again, is very slow growing. Some of it may never even break outside of that capsule, won't metastasize. So the question is, are we doing too much over-treating these lesser aggressive prostate cancers? So the formal recommendation is, again, based on the society, but the most common is from age 55 to 69. You can screen with either a physical exam or by checking a marker in the blood, the PSA. For Biden's age group, a lot of physicians wouldn't actually be screening for it. Sometimes you'll check a PSA, but a PSA could be elevated for benign causes, which is actually more commonly elevated for benign causes than actually cancers. So I don't think they were doing aggressive cancer screening when it came to prostate cancer and President Biden. But if you're younger, if you have a family history of prostate cancer as a male, you absolutely want to get screened because there are more aggressive cancers that it could end your life early. And we don't want to do that when we have treatments. And it's always better when you catch it earlier.
Dr. Nicole Saphier, thank you so much for joining us. Really do appreciate it.
Thanks.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.